Hi, Leslie. Long time no see. How have you been?
Hey Connor, I've been good. I'm actually currently in a research lab at Yale, but I'm also in the process of applying to graduate school to become a genetic counselor.
Wow, genetic counselor. What is that?
So essentially, a genetic counselor assesses an individual or a family's risk of inheriting a variety of conditions such as genetic disorders or birth defects.
Oh, wow. Are there any other roles in that position?
Yeah, so I can explain that to you with an example if you'd like.
Sure.
Yeah, so do you remember when my grandma was diagnosed with breast cancer back in high school?
Yeah.
Yeah, so they actually referred her to a genetic counselor.
Oh, wow.
So the first thing they did was they compiled an entire family history and personal history to really look at any previous medical conditions she suffered with or any family cancer diagnoses or anything like that. Then they performed a full risk assessment and they also ordered certain genetic tests. So are you familiar with the BRCA gene?
Yeah.
Yeah, so that actually causes the majority of all breast cancer cases. So they specifically tested her for that.
Oh, wow.
They really try and help you get to the root of your diagnosis, and then they support you through it.
Oh, wow. Where are genetic counselors? Where do they normally work?
Yeah, so they're actually everywhere these days. So they work in hospitals, private practices, laboratories, and even with insurance companies.
Oh, wow. What are some of the subspecialties in the field?
Yeah, so right now there's a lot of specialties. The big ones are really prenatal or reproductive, cancer, pediatrics, and adult or general. But there's also a lot of emerging and up-and-coming specialties like neurology, psychiatry, and even cardiovascular.
Oh, wow. What are you looking forward to most about this line of work?
Well, really everything. But I also love the fact that genetic counselors can follow their patients through their lifespan. I really think that they're capable of guiding and supporting patients, especially when seeking more information about how their condition will really affect their life as well as their family's lives. And I really love that a genetic counselor kind of becomes their patient's biggest advocate.
Well, that's incredible. Best of luck to you.
Thank you so much. And always remember, if you forget what a genetic counselor does, essentially they assess risk, they educate you about your options, and then they support you.
Hi, my name is Leslie Clapp, and I'm currently applying to Baypass Genetic Counseling Program. A little bit about me. Despite how cliche it sounds, I love spending time with my family, my friends, and the people that I love, especially when the COVID pandemic has taken away so much from all of us. I love traveling. I actually spent a semester of my junior year in Ireland, and I bounced around Europe. I love to make new memories, try new things, try new food. I also love the outdoors. I love going for hikes. I like soaking up the sunshine. I think there's something to be said about plugging in my headphones, going for a walk outside and decompressing after a long day or a long week. I think that also there's times that I just want to curl up on the couch under a cozy blanket and read a good book or watch a good movie. And I also really love my volunteer work at hospice. It was largely responsible for me learning how to interact with patients, and I would love to do more of it.